Hello, my name is Omar Hamarshi, and I will be presenting on the psychosocial care for children in conflict zones. Now, before we start, a little bit about me. I'm a rising senior at Blue Valley High School in Overland Park, Kansas. In school, I'm the student body president. I'm an avid violinist and pianist in school and in my personal quartet, and I'm a varsity swimmer. Outside of school, I'm heavily involved with the Palestinian American Medical Association, a non-for-profit dedicated to improving healthcare in Gaza and the West Bank, where I was the president of the youth branch for 2 years. I've also published research on this topic with Al Ahli Arabi Hospital in Gaza. I'm extremely interested in global health, and I hope to one day become a physician. I currently plan on majoring in neuroscience in undergrad. In 2022, about 468 million children, that's 1 in 6, were living in a conflict zone. Keep in mind that this statistic is 2 years old, and as I'm sure many of you know, it's only gotten worse since then. The health institutions in these areas are often overwhelmed with patients in need of physical care. This, coupled with a general stigma against the need for therapy and psychological rehabilitation, has led to a detrimental lack of available and easily accessible mental health care for children in desperate need of it. In our study in 2020 on children in Gaza, 72% reported seeing mutilated bodies on TV. This, coupled with other stressors, led to 33% having severe PTSD. For context, this is more than 10 times the percent of children in the US with PTSD. This can manifest in a variety of different symptoms. Avoidance symptoms can mean a distaste with forming new friendships in school or distancing oneself from familiar relationships. Intrusional symptoms refer to unwanted thoughts that can often be very stressful for the children experiencing them. And arousal symptoms refer to the general phobia and panic-associated reactions with loud sounds and other triggering stimuli. Now, it's important here to note that the diagnosis of PTSD is a bit of a misnomer. The post in post-traumatic stress disorder is very accurate for war veterans. These are people who have gone, experienced trauma, and after coming back home are still dealing with the stress of that trauma. However, part of the trauma experienced by children in ongoing conflict zones is the fact that they have to wake up and see it all again tomorrow. Now, this is something that needs more research and is beyond the scope of this presentation. But keep in mind that this PTSD diagnosis might not be fully encapsulating of the trauma experienced by these children. So what? When these needs aren't addressed, we see an increased risk of school failure, more contact with the criminal justice system, more dependence on social services, and increased rates of suicide. So how do we address it? The first step is obviously diagnosis, which requires a psychiatric screening. However, this is inhibited by a lack of access to trained psychiatric professionals, a lack of knowledge on the risks of mental disorders and the need for psychiatric screening, and a general stigma against needing psychological care. Once diagnosed, there are a variety of methods for treatment, varying from psychosocial first aid, which refers to when a large organization, after being notified of a large traumatic incident, will send trained mental health care professionals to provide psychological rehabilitation on site, to forms of session-based rehabilitation. However, these are inhibited by a lack of financial ability to afford care. The Palestinian American Medical Association, after noticing this lack and need for care in Gaza, began the Psychosocial Rehabilitation Project, in which we delivered a form of session-based rehabilitation using the CABAC method, which stands for Children Affected by Army Conflicts. In this method, since 2019, we've helped more than 1,200 children. These children participated in individual and group activities aiming to improve their self-esteem and self-awareness. After this intervention, as you can see by this graph, their PTSD score, a metric we use to compare their improvement before and after intervention, drastically improved, as well as their intrusional, avoidance, and arousal symptom subscores. This shows serious promise for interventional methods like these in improving the psychological well-being of children in active conflict zones. Now, this isn't nearly over. This is just one study and a microcosm of the global need for these kinds of interventions. According to the organization Save the Children, only 1% of the world's global budget is allocated to children's mental health. This means that there are millions across the globe who are in need of interventions like this, however have no ability to access it. So how can you help? One great way is providing funding to organizations who are doing programs like these. I can obviously personally vouch for the work that the Palestinian American Medical Association has done, but the World Health Organization, UNHCR, UNICEF, and UNFPA are other amazing places that you can donate to help this cause. If you aren't comfortable donating, awareness is just as important. More specifically, destigmatizing the need for psychosocial rehabilitation. By normalizing and bringing this topic up, it makes that access for psychological rehabilitation easier and more accessible. I want to thank Al Ahli Arabi Hospital for training all the mental health professionals involved in this project. I want to thank the Palestinian American Medical Association for organizing and providing funding. And obviously, I want to thank the Global Health Leaders Conference for providing me with a platform to speak on something I'm very passionate about. If you have any questions, please feel free to contact me. Thank you so much for listening.